Welcome to this video on Medicare 101 Basics Explained. For employers, employees, and their dependents. This video does not cover every Medicare-related situation, just the basics. Consult with your state license, Medicare certified, independent agent for more information on your specific situation. So let's begin. Here is what you'll learn. First, the 4 parts of Medicare and what they cover. Second, Medicare supplements or Medigap insurance policies, and the out-of-pocket costs they pay for. Then the out-of-pocket costs associated with Medicare Part A and Part B. Next, what is IRMAA and how much more you pay for Medicare based on your income. Then, choosing between Medicare and your group health plan. Next, the 3 most common Medicare enrollment periods. Then, how to enroll in Medicare. Finally, compare monthly premiums, out-of-pocket costs, and benefits of original Medicare versus Medicare Advantage. So let's get started. Medicare has 4 basic parts. Part A, hospital insurance. Part B, medical insurance. Part C, Advantage plans. And Part D, standalone prescription drug plans. These are health insurance plans that cover your medical and prescription drug needs. In addition, there are Medicare supplements or Medigap insurance policies that cover the costs that Part A and Part B don't cover. First, let's look at Medicare Part A, hospital insurance. Medicare Part A, hospital insurance, covers Medicare-approved hospital-related services when you are admitted as inpatient, including a semi-private room, meals, medications, and acute care services. It also covers Medicare-approved services received in a skilled nursing facility. Medicare Part A also covers home health care services such as skilled nursing, speech therapy, physical therapy, and occupational therapy. It also covers hospice care and mental health services. Remember, Medicare is not long-term care insurance. It does not cover the 6 standard activities of daily living. Now let's look at what Medicare Part B medical insurance covers. Medicare Part B medical insurance covers all Medicare-approved services or supplies needed to diagnose or treat a medical condition. This includes doctor visits, outpatient care, ambulance, durable medical equipment, mental health services, and home health care if you're homebound and need skilled care. Medicare Part B also covers preventive services such as screenings, vaccinations, annual wellness visits, smoking cessation, and depression screening. Medicare Part B also includes limited prescription drug coverage, such as injectable drugs, insulin for insulin pumps, certain oral cancer drugs, and immunosuppressive drugs. It also covers diagnostic tests and lab services. Finally, Medicare Part B also covers physical and occupational therapy and speech-language pathology. Next, let's look at Medicare Part D, prescription drug plans. Medicare Part D prescription drug plans are available in 2 ways: as a standalone Medicare Part D prescription drug plan, used with Medicare Part A and Part B, or included in a Medicare Part C Advantage plan. It covers the most common outpatient drugs prescribed by your doctor, including medications for chronic conditions and drugs in all major therapeutic categories. Medicare Part D covers vaccines such as shingles, RSV, and tetanus. Remember, flu, COVID-19, and pneumonia vaccines are covered under Part B, not Part D. Finally, Medicare Part D covers some medical supplies such as insulin used in pumps and certain anti-rejection drugs. So, how does Medicare Part D decide which drugs to cover and at what level? Each insurance company offering Part D plans establishes a formulary, which is a list of covered drugs organized into tiers. Each plan has 5 tiers, starting with Tier 1 preferred generics, the lowest cost, up to Tier 5 special or non-preferred brands at a higher cost. Plans may require prior authorization, step therapy, or quantity limits, depending on the drug. In addition, Medicare has established 3 cost-sharing phases to help reduce how much you pay for prescription drugs. This cost is shared between you, the plan, the drug manufacturer, and Medicare. For example, in Phase 1, the deductible phase, a plan can have a maximum deductible in 2026 of $615 per year. A Part D plan may apply, or waive the deductible depending on the drug and which tier it is in. Next is cost-sharing Phase 2, the initial coverage phase. This is where you pay 25% of the retail cost of a drug, in the form of either a copay or coinsurance. You continue to pay this share up to a maximum out-of-pocket in 2026 of $2,100. Finally, there is Phase 3, the catastrophic coverage phase. Once you reach $2,100 out-of-pocket in 2026, you pay zero for covered drugs for the rest of the calendar year. So, what is included in the true out-of-pocket costs? They are the annual deductible, copays and coinsurance, payments made by others, state pharmacy assistance program, Medicare Extra Help, and most charities. Not included in the true out-of-pocket costs are monthly Part D premiums, amounts paid by the drug plan itself, drugs not on your plan's formulary, drugs purchased outside the U.S., over-the-counter medications, and most vitamins. Next, let's look at Medicare Part C Advantage plans offered by insurance companies. Where Medicare Part A and Part B are government-run healthcare, Medicare Part C Advantage plans are a bundled alternative offered by private insurance companies approved and subsidized by Medicare. They offer the same Medicare-approved services as Medicare Part A, Part B, and many have Part D coverage. Plus, they offer additional supplemental benefits that Part A and Part B don't offer, such as dental, vision, fitness, and over-the-counter benefits, and more, at no additional cost. Finally, let's look at Medicare Supplements, or Medigap insurance policies. Medicare Supplements, or Medigap insurance policies offered by private insurance companies comply with Medicare and state insurance regulations. These private policies are not health insurance. They only pay the out-of-pocket costs not covered by Medicare Part A, hospital insurance, and Part B, medical insurance. These private policies offer a variety of plans from Plan A through Plan N, each designed to pay a specific set of out-of-pocket costs. Here is an illustration of all the Part A and Part B out-of-pocket costs listed in the left-hand column. Then which Medicare Supplement plans, A through N, cover those costs. The most comprehensive plan is Plan G, which covers 100% of the costs except for the Part B deductible. Plan F is no longer available to new enrollees. Not all plans are available in every state. Each plan is priced separately. Your independent agent can help you find a plan that best meets your needs. Now let's take a closer look at the Part A and Part B out-of-pocket costs. First, Medicare Part A hospital insurance is not free. The out-of-pocket costs in 2025 are listed here. The most significant is the $1,676 deductible when you are admitted as inpatient into the hospital for days 1 through 60. Medicare Part A does not pay if you are admitted only for observation. So it's important that when you are admitted into the hospital, you are admitted as inpatient. In addition, Medicare Part A covers the first 20 days of skilled nursing care at no cost to you. It's important to know that Medicare Part A hospital insurance is based on a benefit period, not a calendar year deductible. A benefit period begins on the first day you receive service as an inpatient and ends after you have been out of the hospital and have not received skilled care in any other facility for 60 days in a row. So, if you are admitted as an inpatient after that time, a new benefit period begins with a new Medicare Part A deductible. Next, let's take a look at the out-of-pocket costs for Medicare Part B medical insurance, as shown here. In 2025, Medicare Part B covers 80% of physician services, outpatient care, tests, and supplies, after a $257 annual deductible. However, you are responsible for all excess doctor charges, that is, all charges above the Medicare-approved amounts. Now let's take a look at how high-income Medicare beneficiaries pay more for Medicare, in the form of an income-related monthly adjustment amount. In 2025, the standard Part B monthly premium is $185 per month. If a Medicare beneficiary's modified adjusted gross income, or MAGI, in tax year 2023 is more than $106,000, filing individually, or $212,000 filing jointly, they'll pay more for their Medicare Part B in the form of an additional IRMAA monthly surcharge. The higher the income, the higher the IRMAA surcharge. Next, in 2025 on the Part D prescription drug plan, if a Medicare beneficiary's modified adjusted gross income, or MAGI, in tax year 2023 is more than $106,000, filing individually, or $212,000, filing jointly, they'll pay more for their Medicare Part D in the form of an additional Part D IRMAA monthly surcharge. This is in addition to their Medicare Part D monthly premium. The higher the income, the higher the IRMAA surcharge. If you enroll in Medicare Part A and Part B only, but not Social Security, then you'll receive a quarterly bill from Medicare for 3 months of premiums on Part A and Part B. If you are a high-income earner, then you'll pay additional Part B IRMAA and Part D IRMAA surcharges if applicable. Most Medicare beneficiaries get Medicare Part A at no cost. If you enroll in Social Security benefits, then these charges will be automatically deducted from your Social Security deposit. Now, let's look at the factors to consider when choosing between Medicare or your employer's group health plan. So, when can Medicare be a better option? First, Medicare sets the prices for all Medicare-approved services. Generally, the costs can be up to 40 to 50% less when compared to your employer plan. Second, with original Medicare Parts A and B, there are no networks. You get nationwide coverage. Any provider that accepts Medicare means you're covered. Third, with original Medicare Parts A and B, plus a Medicare Supplement Plan G, all Medicare-approved out-of-pocket costs are covered at 100% after you pay a $257 annual deductible in 2025. Next, many Medicare Part C Advantage plans or Part D prescription drug plans have low or no monthly premiums. Finally, many Medicare Part C Advantage plans have low to no medical deductibles. Next, many Medicare Part C Advantage plans offer supplemental benefits like dental, vision, hearing, OTC, and fitness benefits at no additional cost. Also, many Medicare Part C Advantage plans or Part D drug plans offer low to no cost on generic drugs. It's important to know that if you work for a small employer with fewer than 20 employees, Medicare pays claims first, before the employer plan. So, it's important to enroll in Medicare at age 65. Finally, ACA Marketplace plans are not considered creditable coverage by Medicare after age 65. That means you may face Medicare late enrollment penalties for life. So, when is Medicare not the best option? First, if you are a high-income earner, that is, in 2023, you reported on your tax return a MAGI of more than $106,000, filing individually, or $212,000, filing jointly. If you did, you'll be assessed a monthly IRMAA surcharge on both your Medicare Part B and Part D monthly premiums. The higher the income, the higher the IRMAA surcharges. Second, if you have dependents under age 65 who still need health coverage, they would need health coverage through the ACA Marketplace, where plan premiums are based on your age. Third, not all prescription drugs are covered under Medicare Part C Advantage or Part D prescription drug plans. Also, if you use expensive prescription drugs, Medicare Part C or Part D may not be your best option. Also, Medicare may not be your best option if you currently have low or no prescription drug out-of-pocket costs. Next, Medicare doesn't typically cover experimental or non-Medicare approved treatments, procedures, or equipment. Also, if you contribute to a health savings account or HSA, remember, once you enroll in Medicare Part A, you may no longer contribute to an HSA. Finally, if you pay low or no monthly premiums on your current health plan, Medicare may not be the best option for you. So, starting at age 65, Medicare keeps track of whether you have medical and drug coverage that is at least as good as Medicare. It's called having creditable coverage. If you have any gaps in coverage, Medicare may assess late enrollment penalties for life. Employer plans are considered creditable coverage, or just as good as Medicare, so no late enrollment penalties will be assessed. However, if you do decide it's time to enroll in Medicare, the three most common Medicare enrollment periods are the Medicare Initial Enrollment Period, the Medicare Special Enrollment Period, loss of employer coverage, and the Medicare Annual Enrollment Period. There are more enrollment periods available for very specific reasons to enroll in Medicare. Individuals may only sign up for Medicare using a specific enrollment period. So, let's start with the Medicare Initial Enrollment Period. This is the first opportunity for individuals turning age 65 to enroll in Medicare. You can enroll up to 3 months before your birth month. Medicare always starts on the first day of your birth month. When you enroll, you'll receive your Medicare ID number and Medicare Part A and Part B effective dates. Once you have this information, you can sign up for other Medicare plans. The earlier you enroll, the better, so you have time to learn all about your Medicare options and choose Medicare plans that fit your specific health and financial needs. Next is the Medicare Special Enrollment Period, loss of employer coverage. Assuming you'd have employer coverage, this is your opportunity to enroll in Medicare after turning age 65 without incurring late enrollment penalties. To enroll in Medicare, there is an extra step. That is, complete Form L-564, Request for Employment Information signed by your employer. This form attests that you have been continuously covered by your employer plan since turning age 65. You have 60 days to complete the special enrollment period. Finally, once you are on Medicare, every year you have an opportunity to change plans during the Medicare Annual Enrollment Period. It's your opportunity to join, drop, or switch government-subsidized, Medicare Part C Advantage, or Part D prescription drug plans effective for the next calendar year. The Medicare Annual Enrollment Period begins October 15th and ends December 7th. Note that Medicare Supplements or Medigap plans are private insurance policies and are not part of the annual enrollment period. So, how do you enroll in Medicare? The Social Security Administration is the gatekeeper for Medicare. First, create an account on the Social Security website at ssa.gov. You'll need to verify your identity through login.gov using your Real ID driver's license. Next, choose which Medicare enrollment period to use, either new to Medicare or the Special Enrollment Period loss of employer coverage. If you use the loss of employer coverage SEP, then you'll need to complete the request for employer information form first. Your agent can help. Then, complete the online application. You can apply for both Medicare Part A and B, or Part B only if you already have Part A. If you apply for Social Security benefits, you will be automatically enrolled in Medicare. It may take a month or two to get your Medicare card in the mail. In the meantime, learn about all your Medicare options. It's best to get help from an independent, state-licensed, Medicare-certified insurance agent. There is no additional charge to use an agent. Their compensation comes from the plans they represent. Then, once you have your Medicare information, enroll in the Medicare plans that fit your health and financial needs. For example, a Medicare Part D drug plan, Medicare Part C Advantage plan, or a Medicare Supplement or Medigap plan. An agent can explain the options and help you enroll, all for no additional cost. Next, receive your new Medicare plan cards in the mail. Finally, create an account on mymedicare.gov. It's your home for all your Medicare information. Now, let's learn more about your two basic Medicare options. Option 1. Original Medicare Part A and Medicare Part B, plus a standalone Medicare Part D prescription drug plan. Add a Medicare Supplement or Medigap. In this example, Plan G. Next is Option 2 Medicare Part C Advantage Plan, which covers the same Medicare-approved services as original Medicare Part A and Part B and Part D, plus has supplemental benefits not covered by original Medicare. Now, let's look at the monthly premiums under each option. Under Option 1, Original Medicare A and B Plus. First, Part A. It's normally at no cost if you paid FICA payroll taxes for at least 10 years. Next, Part B. Monthly premiums are $185 per month in 2025. Then IRMAA Part B and Part D monthly surcharges. They vary by income level if they apply. Next, Part D. Monthly premiums vary by plan and insurance company. Finally, Medicare supplements. Monthly premiums vary by age, plan type, and insurance company. Now let's review Option 2, Medicare Part C Advantage Plans. First, Part A. It's provided at no cost to most people. Next, Part B. You still pay a monthly premium of $185 per month in 2025. Then IRMAA Part B and Part D monthly surcharges. You still pay them as before. Next, Part C. Monthly premiums vary by plan type and insurance company. Next, Part D. There is no separate monthly premium. It's included in Part C. Finally, Medicare supplements. There are no premiums since it's illegal to have a Medigap plan with an Advantage plan. Now let's look at the out-of-pocket cost under each option. Under Option 1, Original Medicare Part A and Part B Plus. Using a Medicare Supplement Plan G, after the $257 annual deductible, the maximum out-of-pocket costs for all Medicare-approved services is $0. All remaining medical costs are paid 100%. Next, using your Medicare Part D prescription drug plan, the maximum out-of-pocket costs for prescription drugs is $2,100 in 2026. Next is Option 2, a Medicare Part C Advantage plan. The maximum out-of-pocket costs for all Medicare-approved services will depend on the specific Medicare Advantage plan. There may be deductibles, copays, and coinsurance you'll pay along the way. Next, using the Medicare Part D prescription drug plan in your Medicare Advantage plan, the maximum out-of-pocket costs for prescription drugs is $2,100 in 2026. Remember, the maximum out-of-pocket costs for prescription drugs is separate from the medical out-of-pocket costs. Now, let's look at the basic differences in benefits between the two Medicare options. Under Option 1, Original Medicare Part A and Part B Plus. First, the cost of care is generally 40 to 50% less than a private health insurance plan. Also, there are no networks. You have nationwide coverage with any provider who accepts Medicare. There is no pre-authorization for Medicare-approved services. Then, if you use a Medicare Supplement Plan G, you only pay a $257 annual deductible. Everything else is covered at no additional cost. Also, you pay no more than $2,100 in out-of-pocket costs in 2026 for all your prescription drugs. However, you will have higher monthly premiums by adding a required standalone Part D drug plan and an optional Medicare Supplement plan. Now let's look at Option 2, a Medicare Part C Advantage plan. First, the cost of care is generally 40 to 50% less than a private insurance plan because of Medicare rates. However, you must use the insurance company's network of providers for in-network services. It may require pre-authorization for some services. Next, you may pay more out-of-pocket on medical deductibles, copays, coinsurance, and maximum out-of-pocket costs along the way. Also, the prescription drug maximum out-of-pocket is $2,100 in 2026. This is separate from the medical maximum out-of-pocket costs. Finally, monthly premiums will be lower when compared to the first option. Finally, there are supplemental benefits. Medicare Part C Advantage plans offer supplemental benefits that Original Medicare Part A and Part B don't offer. These benefits include routine dental, vision, fitness, over-the-counter items, meals, transportation, and Part B giveback, depending on the Advantage plan. Need expert help? Contact your trusted state-licensed, Medicare-certified, independent insurance agent to help you find the Medicare plans that fit your unique health and financial needs. Remember, it doesn't cost any more to use an agent.